be discussing Too Much Too Young, why is policy obsessed with teenage mums. My name is Brid and I work in the health service as a manager and as a sexual health nurse. But I've been a member of the Battle of Ideas Committee since its inception about 6 years ago now. And part of the Social Policy Forum, which this is a strand. The session is produced in partnership with Brooke and in association with the Wellcome Trust. So, I've said what we're going to be discussing, but I think it's useful to ask, why are we discussing it? Why are we looking at this issue now? Because I think it's fair to say we live in a fairly enlightened society. In the days when it was shameful to have sex before marriage or to be an unmarried mother are well and truly gone. It's not a taboo subject. But over the last 12 years or so, teenage parenthood has been resurrected as a social problem, despite the normalising of sex and reproduction outside of marriage. And this is despite the fact that there are fewer teenage parents than previously, and the numbers continue to fall. In 1971, it was 50.6 per thousand, and it's now 26.3, not the 54% that the Conservatives mentioned in their election campaign. So why is there a perception that this is a social problem? Is it really a problem? If it is, what kind of a problem is it? Whose problem is it? Is it a problem for teenagers, for others? I think it's worth just asking what is going on here. So we have well-versed people able to answer those questions, hopefully. And I'd like to thank Jen Macvarish, who is one of the speakers, for helping me identify our panel of speakers. I'm now going to introduce them in the order that they're going to speak in. They all have very long and interesting biographies already, so I'm not going to go through all of that. It's on the website if you want to read more about it. So first is Simon Blake in the middle. Simon is in the middle is Simon Blake. He's the National Director of Brooke, a provider of free and confidential sexual health advice and service, especially for under 25s. He's a trainer, writer and advocate for young people's sexual health. He's a member of both the Teenage Pregnancy and Sexual Health and HIV independent advisory groups. He's written on all aspects of sex and relationships and is the author of Sex, Alcohol and Drugs, Exploring the Links in Young People's Lives. Next we have Ros Edwards, sitting next to me. Ros is Professor in Social Policy and Head of Week Centre for Social Policy Research at the London South Bank University. She's particularly interested in family members' own understandings, how these are shaped by gender, social class, race, ethnicity and generation within geographical, political and historical contexts. She's involved in a number of research projects and is a prolific writer. She's co-author of Teenage Parenthood, What's the Problem? Far left is Lesley Hoggart. Lesley is a Principal Research Fellow, School of Health and Social Care at the University of Greenwich, and she's a Visiting Research Fellow at the Policy Studies Institute. Her research interests are focused on reproductive health, abortion policy and politics, teenage pregnancy and sexual health. She's another prolific writer with a long list of publications, and she's the author of Feminist Campaigns for Birth Control and Abortion Rights in Britain. And our fourth speaker is Dr. Jen Macvarish in the red, orange.
Not Simon.
Okay, we've done that joke. She's a researcher and lecturer in the Centre for Health Service Studies at the University of Kent in Canterbury. Her interests lie in the sociology of interpersonal relationships, parenting, family life, sex and intimacy. She's particularly interested in the questions of risk culture, demoralisation and individualisation, but is also concerned with policy developments. She's a contributor to Teenage Parenthood, What's the Problem, book that Ros co-edited. Those of you who've been looking at the website might have read Simon and Jan's head-to-head blogs in The Independent about a week ago. Jan explained why she was concerned with the teen pregnancy policy obsession, while Simon gave it a qualified welcome. And no doubt they'll elaborate in their introductions. You may also have noticed Jan's battling print entitled How Teen Pregnancy Became Redefined as a Social Problem. It was included in the readings for this discussion. Okay, the speakers are going to have a maximum of 8 minutes to make their points, and I'll be reminding them when it's coming towards the end. And after they've each done their introduction, you can applaud them. Please don't do it in between. Otherwise, they might be measuring who got more than the other. We do it all very egalitarianly. And then after we've had a bit of a discussion here, I'll invite you to contribute, to ask questions, whatever. Okay. Right, Simon.
Thank you, Brid. So let me just start being absolutely clear. I do support teenage pregnancy strategy. If there is a policy obsession with teenage parenthood, I hope it continues in what is going to be a very fast-changing policy context and financial context. And I also believe that young parents can be very good parents. And those things don't sit at opposite ends of the spectrum. When I think about teenage pregnancy, what I do at Brook, because we see and have direct contact with 1,600 young people every day, is that what we actually have to do is talk about teenage sex, because that's what young people are interested in, that's what young people come to us for help and advice about. They don't sit talking about policy constructs around teenage pregnancy, they just want people who are going to help them. So one young person fairly recently said, I just want clear, honest information about sex. And that's a constant plea from young people. The UK Youth Parliament yesterday talked again about sex and relationships education. And decade after decade, we continue to ignore that, and we just haven't sorted out helping young people to understand about relationships and sex first. So let me start with what I would see as some facts. They might be debatable, but they're facts that I understand. The first is that teenage pregnancy and parenthood is actually about teenage sex, and we've got to get to grips with talking about sex as much as we like talking about teenage pregnancy. That everyone overestimates the levels of teenage pregnancy. If you talk to young people, they overestimate it to a much greater extent than people do the older they get. We have the lowest rate for 20 years in this country in the context of fast social change, but it is still the highest in Europe, and I believe that that is something that we need to take note of. The latest statistics show approximately 39,000 young women became pregnant under the age of 18 in England and Wales, which is a reduction of 14% in conceptions, 25% in live births in the last 10 years, and approximately 50% of those conceptions ended in abortion. Now, to me, that shows that something isn't yet right with the contraceptive help and advice and support that we're giving young people. As I said at the beginning, with the right support, young parents can be very good parents. And I was sat in a Brook Centre with somebody recently, aged 23, just had her 4th baby, had planned to have her 4th baby, and now wants to go back to university, and absolutely fine. She's a very good parent, she's had very good support. And the teenage pregnancy strategy was as much about reducing conceptions, supporting young parents to be better young parents, as it was to achieve a 50% reduction in conceptions. And sometimes people forget that. So the policy obsession with young parents becomes focused on the fact that there is a desire to reduce the level of conception. That strategy was designed in 98-99 based on an analysis showing that teenage pregnancy is both a cause and consequence of social exclusion. We know that it's linked to deprivation and aspiration, but it's not exclusively a deprivation issue. Some work we did in independent schools, a young woman just said, people think I'm a rich kid, but I do have sex. So we have to remember that this isn't just purely a deprivation issue if we think about it in the lives of young people and sex. So, back to the question, is policy obsessed with teenage pregnancy, teenage parenthood? I would say that as a country, and young people tell us this every single day, that we are obsessed about teenage sex and not always in the right way. If you look just in one newspaper, in the last week, there were 7 articles about young people and sex, one of which described them as promiscuous, one of them which described teenage pregnancy rates as soaring when we know the opposite is true, one of them which talked about sexually transmitted infection rates soaring when of course they're going to be higher when we've been testing and screening more young people. So we are seeing stories all the time of promiscuity, earlier sex, soaring rates, and none of it is true. None of it's based on young people's lives and not much use to young people. And what young people, I think, deserve is a country which is obsessed with sex but in the right way, to help them to ensure that if they do have sex, they're able to enjoy and take responsibility for it. With that strong focus on teenage pregnancy over the last decade, and I do have to remind colleagues that it wasn't just a new Labour construction, it was actually identified as a public health issue in health of our nation in, I don't know, the early 90s, mid-93. And what it has done, if you look overall, is to help improve sex and relationships education, improve sexual health services, and I believe it's starting to help change our culture towards young people and sex. And we're no longer anywhere near good enough yet at actually having a positive culture about young people and sex. And it has helped to improve the support that young parents get. And I think what I really worry about over the next 2 or 3 years is that we'll see many of those initiatives that have helped those young parents who either chose to be young parents or have become young parents accidentally and decided to continue with the pregnancy, that we'll see a reduction in the level of support that they get, and that would be wrong. So I don't think that it is wrong to focus on teenage pregnancy. I know that the strategy has inevitable flaws in design and delivery, and I do believe that in some ways we've got slightly obsessed in the analysis of teenage pregnancy, which shows that if we focus on it, it means that we believe that teenage parenthood is wrong. And just to remind us that the strategy was set out to reduce teenage pregnancy by 50%, not to eradicate it. And I think that we just need to be very clear about that. I think it's wrong to leave young people without the education support they need about sex and the culture in which we set high expectations about their sex so that they can set high expectations about sex for themselves. I worry that young people are having sex on cold, wet windowsills without orgasms and actually without the support and education they need. So I think it's right that policy focuses on teenage pregnancy. I think it's right that we support teenage pregnancy, teenage parents. So if there is a policy obsession with teenage pregnancy and teenage parenthood, what I want is the debate to be to make sure that we get that policy right, not that we don't have it at all.
Thank you. Now you started, you've got to tap them all individually for the same length of time. Rose.
To the way here, what I've got to say first. Okay. 80% of teenage mothers are aged 18 to 90. Right, okay, sorry. 80% of teenage mothers are aged 18 to 90. Just under 40% are married or cohabiting. Most teenage mothers don't actually plan to get pregnant, but they quite like a baby and don't use contraception because of that. And research shows that it's not the teenage bit that causes poor outcomes, it's the social and economic disadvantage that produces poor outcomes for mothers and their children. So I want to step back a bit and think, well, why have policymakers and politicians focused on teenage pregnancy as something that's got to be dealt with? And I'm going to raise 2 issues in relation to that conundrum. Firstly, there's the way that childhood is understood in contemporary society and the moral overtones attached to that. Childhood is constructed as separate from adult responsibilities. It's underpinned by ideas about naturalness and innocence and so on. Teenagers are sitting very uneasily on this boundary between childhood and adulthood, between innocence and sin, especially for young women. And in obviously having sex, impregnating and becoming pregnant, and in taking on the adult responsibilities of parenthood before they've sort of shaken off the immaturity of childhood from their shoes, you have young mothers and fathers destabilising conceptions of the social and the generational order that sees a fundamental, essential boundary between states of childhood and adulthood. Now that destabilisation, I would argue, is so significant because the rearing of children is linked to the economic and moral destiny of the nation. So that's taking place in the context of a declining belief in the ability of other mechanisms like economic control to actually determine the nation's trajectory. So parents are seen as fostering critical values and behaviour for their children that determine the public good. So if children are regarded as the nation's future and they're deficient in some way, then the prospect is grim. So young parents are thought about as producing children that they can't possibly care for adequately and rear to be the responsible citizens of the future because they themselves fall outside the boundary of mature self-regulating behaviour. They are children having children. And that leads to my second issue, which is rationality. Policymakers rely, we heard a bit about this in the first session of social policy strand here, policymakers rely on economic rationality criteria to understand human behaviour and to shape policy. And economic rationality isn't only understood as a motivation by policy shapers and makers, it becomes understood as legitimate motivation. So economic rationality takes on a moral authority. Teenage mothers and fathers are envisaged as ignorant, immoral, or both because they've deviated from a cost-benefit planned pathway of life. The very fact that they've impregnated or become pregnant is proof that they aren't acting rationally in their own best interests. So they've got this social and emotional gap between the understandings and experiences of young mothers and fathers and those of the policymakers who formulate the policies that attempt to channel their lives and decisions. So does that mean that the state and service provision should leave teenage parents alone? Actually, I don't think so. While there is a gap between policy making and young mothers and fathers' lives, in my experience, the services that actually work on the ground with teenage parents have a more realistic understanding. And I think that in a situation where young parents are stigmatised, then they can get a sense of esteem and support from staff and from each other, which is really valuable and valued. So I don't think that the dedicated support services should disappear. I think that the targets that they're set regarding pregnancy rate reduction and numbers moving into education and employment and training, I think they should disappear. And at a more general level, I think that the state needs to recognise the value of parenthood in itself, both for the individual mothers and fathers concerned of whatever age and partnership status, and collectively for society as a whole. So a balance between care and education and employment, that needs to be regarded as a necessity and as a policy for all parents, rather than the positioning of children as barriers to the uptake of paid work, which is happening at the moment. And finally, an important building block is a focus on improving and providing good quality education and training and employment opportunities for people who live in declining labour markets, including young people, and on regenerating disadvantaged neighbourhoods. And that is just not going to happen under the cost-cutting agenda.
Excellent. Okay, it's Lesley's turn.
Thank you. I think to start off with, I'll just reflect back a bit and suggest that the teenage pregnancy was in trouble even before the recent election. It was in trouble because the targets were due to be missed, and to be missed by a long way, and because increasingly the underpinning rationale had been challenged. The rationale being that having a baby as a teenager leads to worse outcomes for mothers and for the child than it does for other older mothers. So that had been challenged, and I think that these two issues are connected, and the way I would connect them is really through thinking about the fundamental unwillingness of the Labour government to seriously challenge social disadvantage and social inequalities. So if you're thinking about the way teenage pregnancy was formulated in the very beginning, social deprivation was seen very much as a causal factor in teenage pregnancy, but when the strategy began to be developed, it was very much around knowledge, information. It was around educating young people to behave in a particular way, to give them more information about contraception, and increasingly towards the end of the last Labour government, about targeted interventions towards young people who might be considered to be at risk of becoming a teenage parent. And I think that research since 1997, since the teenage pregnancy strategy was developed, had shown very clearly, and Ross has indicated this, that social deprivation and social economic inequalities are the predictors of worse outcomes, rather than the age at which the age of motherhood. And what really began to worry me towards the end of the last government was the eugenic implications and undertones of the way in which the strategy was developing. Because if you begin to take the research seriously that is indicating that what is a driver are the socio-economic disadvantages of the young people who are becoming teenage mothers. And I'm saying this is statistically on a large scale. I'm not saying this is for every teenage mother, teenage parent, obviously. You're talking about a strategy in which you are discouraging undesirable people from breeding, and I think that there was definitely an undertone of that in the teenage pregnancy strategy. Now, I'm not going to accuse everybody who worked and tried to and did a lot of very good work around teenage pregnancy and young people and sex of going along with those ideas, obviously, but I think we do have to look at the implications of the policy itself. But what I want to do from that is to, in a way, complicate the debate a little bit further and to raise some issues that we might think about now after having had the strategy for such a long time, and to also then maybe raise questions about what I see as another side of the debate and what I think of a danger of a redemption dialogue. And what I mean by that is that an awful lot of the research, particularly qualitative research, has been around good outcomes for teenage mothers and positive choices of becoming a mother. And I've done some of that research, and I think that is very, very important, and I don't want to lose that. However, the positive choices are made in a particular context. And I think that we've not really given maybe enough attention to the context in which those choices are made. So, again, going back to the context, we have social deprivation and social inequalities. And this is actually part of the redemption dialogue. So, young people whose futures don't look that great on paper are choosing to become teenage mothers, and they're turning their lives around. I mean, I have heard this phrase quite a lot, and I've actually used it quite a lot myself. They're turning their lives around, and I think we have to think a little bit more seriously about that and talk about the socio-economic conditions in which they're making those choices, and should we also be talking about changing those conditions as well. And the second point I want to make about the context in which the choices take place is, are we saying that these are positive choices for all teenagers in all circumstances? We know that the idea of intent and planned pregnancies, unintended pregnancies, wanted, unwanted, is very, very complicated. And it's really not so easy to say that this pregnancy was planned or not planned. So unplanned pregnancies can become wanted pregnancies. There's some where it's completely ambiguous and you probably don't even know. And incidentally, this isn't just an issue for teenagers, I think. And the research on teenage motherhood has shown this complexity. And it's also shown that sometimes for young women, for teenage girls, that having their baby is the least bad of two bad options. And this is what I want to end up with, because I really think that the debate needs moving in a different direction, and it's about reproductive rights and reproductive control. And abortion is an important part of that. So Simon mentioned that 50% of teenage pregnancies end in abortion. We shouldn't problematise that. If somebody gets pregnant and they don't want to be, there's a fairly straightforward solution, that's to have an abortion. But actually, there is something in this country for some people, which Janet Hadley wrote about some time ago, called the awfulisation of abortion. And this is part of the context in which a lot of young people make their choices. And I've looked at what teenagers have to say about the SRE, about SRE at school, about their views on abortion. And often, not all, but often, and in some cases, a young person will decide to go ahead with a pregnancy because they believe they are tied up in the awfulisation of abortion debate. And people actually talk about, I didn't want to kill my baby. Now that is not a good context in which to make these sorts of choices. So I would like the debate to go forward in two ways. One is the reproductive rights debate, and the other is to talk about socio-economic change.
Thank you. And finally, Jen. Thank you. Yes, so I wanted to, when I wrote The Battle in Print, the thing I wanted to try to do was to really stand back from this issue, which I've been immersed in work terms for the last 5 or 6 years or so. And it's something that, thankfully, there's been a really great debate going on within academia. And when I was talking to Brid about putting together a panel, really the motivation was to have a panel that's actually on quite close terrain, but actually where we can start to try to ask some of the really difficult questions that I find that come up in this area. And so I just wanted to start by sort of looking at why teenage pregnancy has come to such prominence. And I think it doesn't really work just to look at the UK in that respect. And I think one of the things that in Britain we've really missed out on, or we were late to realise, I suppose, when we came at this issue, is just how much of the debate had already run its course in America. And I know Ellie this morning kept referring to Kristen Luca's work in America, and there's some incredibly substantial research done across the Atlantic, which I think has tended to get ignored in some ways because the policy discussion has always sought to contrast us with other European countries. And I really, when I started to delve into the American literature, I think there's far more lessons to be learned in many ways from collaboration with our American colleagues and in some ways with some of the European discussion or the comparisons with Europe. I think the reason why, and this becomes particularly clear when we compare with America, the reason why teenage pregnancy is such a prominent issue is because it's all things to all people. If you look within the issue, it's got so many different facets. It incorporates so many current social anxieties. And that makes it both very confusing and also a very, very rich area, which has managed to sustain my interest in it over quite a long period of time, and many other people who are kind of working within this field. And I think when you think about that phrase, children having children, which emerges in the States much earlier than here, and became a real, a Newsweek cover issue, something that really was kind of emblematic of the social problems of our time. It's a sort of Hieronymus Bosch vision, really, isn't it, of things turned upside down, things happening that shouldn't be happening. And as an issue, it became something in the 1990s that Clinton in the States took on board as a consensus-building issue on a new political terrain that had really moved beyond the old boundaries of left and right. So I think for me that really helps to inform why it's come to such prominence over here. And over in the States, it was very much part of the kind of outcomes of the culture wars over there, where there was much concern about changes in family life, in marriage, in sexual morality, which is why in the States it's much more about sex education, abstinence education, marriage and divorce, also the racial dimension over there. Over here, as far as it is a debate, and I don't really think it has been so far, I don't want to use the word discourse because it makes me wrinkle and feel a bit uncomfortable because that's what we talk about in academia all the time. But as far as it has been a debate over here, then I think it's got everything in it. It's got the discussion about family change, about marriage, about inequality, poverty and welfare. It seems to be a structural discussion because it seems to be about poverty and inequality. It seems, particularly in the social exclusion language, it was something that looked like a structural issue. But actually, I would argue it's absolutely about individual behaviour and locating social problems at that level. It has got some very, very interesting questions about state intervention and support. Also, obviously, as Simon's outlined, questions about teenage sexual behaviour and morality.
and teenagers, but also really explosively around children themselves, with the concern that increasingly comes up about younger and younger people apparently having sex and apparently getting pregnant and apparently having babies. So I think there's so many different elements to this. And I think, but for me, the two most interesting questions are, one is the relationship between adults and the next generation, and how adults should shape the next generation's values, beliefs and behaviour. I think there's huge questions in this issue about how we legitimise doing that and what we think we should be doing when we're doing that. And then the second feature, which for me is very, very important and really connects with my broader interest in parenting, is the politics of privacy and autonomy, and how teenage pregnancy as an issue has played a really important role in shifting the terrain around issues of private life and the boundaries between public and private, and really important questions about what adult autonomy is and what it should be. So there's two levels to the debate. On the one hand, there's the academic milieu, which has had, as I said, quite a kind of lively debate going on in recent times, largely sort of challenging some of the policy claims about outcomes, questioning some of the methodologies around qualitative versus quantitative research, and also looking at why policy has politicised teenage pregnancy in the first place. And this has tended to pitch itself against policy and wider prejudices as they're understood, that have often kind of characterised as emerging in the popular press, particularly the Daily Mail, as that teenage pregnancy is a moral panic as a concern. The more kind of liberal side of that is the talk about Britain having a particularly dysfunctional sexual culture, which teenage pregnancy comes out of, and that teenagers in general are out of control, and this runs in tandem with binge drinking as a social concern. And I think when you look at those kinds of dynamics, you can see why the teenage mother really becomes a kind of poster girl for ideas about social decline and a really profound social pessimism. But it doesn't really, this interaction between the two levels of debate doesn't really address the resonance that a teenage mother has in wider popular perceptions, which for me is really important in trying to understand why she keeps on bouncing up as something that we are preoccupied with. And so that's the sort of the question I want to just finish up with, which is, I think, as people have said, the teenage pregnancy issue redefines social phenomenon as behavioural problems, and social, as it exists in this discussion, really means culture or community, which actually means a mass of individuals living in a particular location. It's not social as we would have understood it, I think, in a historical sense. Therefore, if the problem is individuals, then the solutions must be individual change, culture change. And in this way, I think the teenage mother has been a lab rat in experiments in changing social behaviour. And if you look, we can come back maybe to the family nurse partnership. I won't talk about that at length now. It's something that's very popular with the new coalition and has really pioneered, or is trying to pioneer this kind of level of intervention. So the problem has been redefined as one more of parenting than one of sex, I would argue. As we've given up of trying to confine sex within marriage, we've tried increasingly, I think, to constrain sex with the threat of the reproductive outcome. And the reproductive outcome is not so much the kind of threat of a baby to an individual girl, it's the idea of the social threat of these inadequate girls raising even more inadequate children who will become, as somebody referred to in the previous session, almost vermin-like in their hold on society. So again, a kind of a tipping over of social reality where we have this kind of threat arising from below somehow that we all have to talk about at great length, because somehow this is where the real problem for society lies. I think this is all part, again, as well, of a politicisation of parenting, where the teen mother, because she is a child, many interventions can be justified, but actually the more we delve into parenting policy, and particularly if we look at America as well, we see in America these kinds of interventions are not confined to teenage mothers, they're extended to all, or many young, poorer families. But I think my main concern I want to end up on is the problem of our obsession with the teenage mother is that we infantilise parenthood, and that we both identify with the teenage mum to a degree that we just don't need to do by talking about her endlessly and imagining what her life might be like, and that she becomes a kind of new model parent who embodies our own insecurities about what the parental role is. And I'll stop there. Thank you.
Fantastic. I knew this was a big subject, but it is absolutely huge, and it's painfully obvious from what the contributors have said that there are so many facets and dimensions to this. So just before I go out to the audience, I think it might be just worth us engaging in a bit of a discussion here on the panel, because I'm very interested in what's been said about the shift from the moral to the social to the economic. And as a consequence of that, it would seem painfully obvious that meeting targets is a very poor way of addressing any of these problems when we have no consensus as to what the extent of the problem is and the nature of the problem. And I just wondered if, Simon, you wanted to come back on that to start with.
I've been sat here thinking, if we had a group of 50 young people sat in the room, what would they make of this? My guess would be that you would have as wide a split in terms of their actual specific views as there is likely to be in the room now. But what all of them would do would find a way to make it personal to themselves and personal to their beliefs and aspirations. And yes, targets are of course an inadequate way of achieving ideology or utopia. But what the targets have done, if you take them with healthy cynicism, if they have provided some resource and some focus for people to be able to provide better education and support to young people. Now, I don't disagree with anything that has been said in its entirety. What I do disagree with is that we can do anything other than look at changing our culture towards sex. I don't agree that we didn't look at America. In fact, one of the arguments of people like me who were sat around the table as this strategy was being developed was there was too much of a focus on America and looking at American ways of doing things rather than European cultures of doing things. And ultimately, Christina Luca, when we went to see her in the States, said, you get what you expect from young people. If you go to European countries, they expect young people to be responsible for the sex that they have. They expect them to enjoy and to take responsibility for it, and they do everything they can in social policy to enable that to happen. In America, we're really clear that young people shouldn't have sex, shouldn't have babies, and we do everything we can to make sure they know that it doesn't impact on behaviour particularly at all, because they don't trust us to engage with them. And in the UK, you don't really understand what on earth you want. And I think that that's really true. If you sit and listen to us here, it would be easy to think that some of us think that actually focusing on young people and sex and teenage pregnancy is a good thing and some a bad thing. I think actually if you strip back to the core, what all of us want is for young people to grow up as young people who have aspirations, to know that they have choices, and to then have the services and support to exercise those choices. And if we can focus on that as the driver for policy, then to me, whether that's about a shift to social, economic, moral, public health discourses, we've got a really good chance of getting it right. And until I hear a young person say they don't want better sex education, they don't want to talk with their parents more effectively, they don't want to be able to access services when they want them, they don't want to be able to get an abortion when they want them, I'm going to continue riding on the back of whatever policy obsession there is to improve young people's experience of growing up as a sexual child or young person, moral, immoral, innocent, impure, whatever it is.
Ros, you've been scribbling.
Well, my sort of, I suppose my reaction to what Simon's just said is you seem to be saying that something is better than nothing, even if it doesn't address the actual issue, which I don't disagree with you. But I think if you do feel that you can ride on the back of the misdirected misshapen animals, then fine. But actually, I think one of the functions of being an academic researcher is to actually point that out.
Happy for you too.
I will.
Lesley, I wonder what you thought about Jen's point on infantilizing parenthood across the board.
I just wanted to comment on that. I wanted to comment
Yes.
on. I mean, I agree with the gist of what Jen's saying, but I really wanted to just follow on from some. I'm sorry. I think that thinking about the targets and thinking about the strategy, I think it would certainly be true to say that an awful lot has improved for young people and actually for all women and potentially for the population in terms of sexual health, contraception and reproductive health services. And some of that, possibly quite a lot of it, has been due to the teenage pregnancy strategy and the funds that have been associated with that strategy. So this is something that I think does make it quite complicated and raises different issues. I think in some circumstances that providers have actually maybe been subverting the teenage pregnancy agenda, certainly utilising it in order to improve services in the way in which they wish the services to be improved, which is in the direction that I was suggesting I think we need to move towards, of improving reproductive health for all women. So it's a reproductive rights agenda. And one of the reasons why I'd like to see the debate moved in that direction is because when services are developed in a particular way, with targets attached to a particular policy that is weak, then they are more vulnerable than if they are attached to a policy agenda that has greater strength and foundation. So I think that a lot of the services that have been developed over the last 10 years or so now are under threat, mainly because of the budget and the cuts that the Tories are going to bring in. But I do think also because of the weakness of the strategy and the targets involved. And just one final point on targets, and this is another cause of concern, is that I'm not quite sure what's happening with targets now, maybe Simon knows, that there were targets attached to absolutely everything to do with young people around the teenage pregnancy strategy, and in some cases that would mean directing them to contraceptive choices that might not have been the best choice for them. So a lot of people know that there has been a big drive for particular forms of contraception, which are long-acting forms of contraception. And I've talked to people in PCTs, and they have targets to hit for putting implants into young women. And that is partly because of the teenage pregnancy strategy. And I'm afraid that that's not always the most appropriate form of contraception.
Thanks. Jen, do you want to?
Yeah, I think that there is a real problem here with our culture. I don't think it's a sexual culture as a kind of discrete layer of experience, but I do think there's a real problem with our social our social expectations. I suppose is a good way of putting it. Simon, that you said about the kind of the American lesson, I suppose, which quoting Luca, that we get what we expect from young people. But I do think that the teenage pregnancy preoccupation absolutely feeds into this incredibly negative and very, very low level of expectations that we have of young people, and especially because the kind of disaster scenarios are the ones that are being flagged up continually. And when I did my research with teenage mothers, it was so different to the kind of disaster scenarios, not because it was all rosy and heroic, which I think we sometimes flip-flop into, unfortunately, which is these lovely girls who are kind of lovely mothers, and they're kind of making something of their lives. Well, actually, they may well screw it up a year after the interview takes place. We don't know that. But I think it's really unhelpful to try to sort of find a meaning in it. There is one meaning as it happens, because it's the same with any family. They're all very different. So then the question, I suppose, is what is the problem? And I think that some of Lesley's research is really interesting on this, on questions of choice. And this is why I think responsibility and choice are really the key questions that we're talking about here, and expectations of young people, if we're talking about it from a young people kind of dimension. And that is, what do we think responsibility is, and how realistically do we demand that of young people, and what age? Because I think we're really, really confused about that. And the thing I really don't want to see happen anymore is the infantilisation of sex and of parenting. And I think when sex becomes something that is just almost, we sort of almost accept that we don't like it, but we sort of accept that it's going to happen. But we don't really then construct it as something that's an adult thing, and it's an aspirational activity that becomes more adult as you get more serious about it and do it more. And I think that that's something that we need to really address. But that's, I don't think we necessarily get by talking to young people so much as sort of as deciding as adults what we think about this thing.
Okay. Huge amount of stuff on the table. What I'll do now is ask you to put your hand up. Bear in mind that I'm looking straight into the light and it's a bit hard to see. And I'll take questions in 3s or 4s and then ask the panel to respond to the ones that they want to respond to. At the very back, guy with the glasses?
Yeah.
No, you don't have to say who you are, but you can if you like.
It's more an observation. I don't know if the panel are aware of what I believe is a growing belief in the US and in some sort of global NGOs like the World Health Organization in the premises behind something called the girl effect. And this is a belief that tackling, among other things, teenage pregnancy in the third world is a way of realising and maximising the potential that teenage girls have for driving the growth of prosperity in those countries. And it's not something I've heard mentioned here before, and I'm just wondering whether or not it's a pointer to maybe a latent motivation behind this focus on teenage mothers over here, and whether or not the panel feels there's anything in that at all.
Okay, there's a guy in the blue shirt just in front.
Yeah, Stuart Wheaton. A question and a point with another question at the end of it. First one is, I'm interested in how the panel think about social policy today, because on the one hand, professionals seem to be driven very much by government fads. So if the government says obesity, it seems to be professionals suddenly turn up with lots of research and all that. On the other hand, the governments don't seem to be driven by politics like they might have been in the past, and seem to be more driven themselves by professionals and professional expertise. So I'm wondering how the panel think about that. Also, I was interested in the way Simon said, he gave out some figures, and then he said, something isn't right with the contraceptive advice, etc. What I always find a bit depressing about professionals, which is almost an inevitability, is professionals always assume if the project they set up didn't work, it must be because they need to do a new project in a new way, and never seem to consider that the project might actually be of no value and actually problematic. And just to finally, second question if you like, I'd be interested to know, Simon in particular, but more generally, if he understands what autonomy means, and especially the idea of autonomy in the family. I get very irritated when my school are teaching my 8-year-olds about sex and relationships. And there seems to be almost no sense within the sort of professional sphere that their intervention and support might be problematic in terms of the autonomy of the family, and in fact the autonomy of the teenage person who may or may not want to have a baby.
Okay, there's a woman here, and Brid.
And Freddie, I think the point that Simon made is a really interesting one about the lack of a sense in Britain at the moment about kind of what good looks like. And I think the point that you made about Kirsten Lucas' comment, I hadn't really thought of it in that way before, but I think it's absolutely right. That if you look at kind of continental Europe, there's much more, well, if you look at the kind of liberal northern European end of continental Europe, there's very clearly a sense that it's okay for kids to have sex. there's a very strong ethos towards preventing unwanted pregnancy. So it's okay for them to have sex, it's okay for them to use contraception, they shouldn't get pregnant, and it's really dumb if they do for them to have a baby, and that's fairly clear. In the US, you're absolutely right, they shouldn't be having sex, they shouldn't be using contraception, you shouldn't be doing anything. And then, you know, if you look at other European countries, there's much more of a sense of family and, you know, family traditional behaviour and so on, so it doesn't become quite so much of an issue. And in Britain, you can really see that in public policy, it's completely confused, because nobody quite knows what we should be saying about a whole number of various different things. So it's very difficult to put a finger on exactly what the issue is, I think, with teenage pregnancy and teenage motherhood, because on the one hand, there's a very clear idea, as the panel said, that teenage motherhood is probably problematized to a point where it becomes absolutely absurd and it becomes demonized and it becomes a metaphor for out of control, unplanned life. But then on the other hand, teenage abortion rates are demonized, and so whereas abortion could be seen as a very legitimate way of dealing with the problem of teenage motherhood, politicians and public policy people can't quite grasp that either. So you get this incredible sense of just, on the one hand, demonising a problem, which is the teenage mum, but then on the other hand, demonising some of the solutions to it. So the only point really that you get to is, again, this weird notion that young people shouldn't be having sex, which then flies in the face of absolutely every other single presentation of sex being a marker of adult life. So the whole thing really does become incredibly confused and very difficult to find any public policy answer to, which I think is one of the reasons why things are so completely confused. The thing that I get very confused about as somebody working in this field, though, is this sense of what young people actually want and where they want to be in relation to sex and pregnancy and behaviour. Because you make the point that you're very happy, Simon, to go along the route of saying, well, I'll ride these beasts until young people start telling you something different from it. I'm really confused at the moment, because as somebody, as a professional working subject to all of the parameters professionally that you say, I'm really inclined to agree with you. As the mother of a 15-year-old, what I find is young people saying, oh, leave me alone, I don't want to talk about it, it's so embarrassing, I don't want, you know, and it just seems as though they're managing it in exactly the same way that my generation managed it 35 years ago, which is with a certain degree of, oh, we'll muddle our way through and get on with it and so on. And they get kind of quite embarrassed about the really right-on policy attempts for us to intervene. So social death for my kid would be for me to go and do sex education at his school. It's the one thing I've had to promise that I will definitely never do, you know? So it's just, all I'm saying is it's really hard to know where we should be going with this at the moment, and I'm really interested in any feedback you've got on that.
Okay.
Because I actually think that assumes too much consensus among professionals and practitioners about what are the issues. And just to say that when we sort of did a launch of the book on, you know, what's the problem about teenage pregnancy and teenage parenthood, we got a lot of nasty emails, but we got quite a lot of emails from practitioners working in the field, doctors, nurses and so on, saying, oh great, it's really good to see someone saying this. So I don't think there's that consensus, and Anne's just saying she's confused. So, you know, that policymakers are relying too much on professionals. What I think that politicians and policymakers do, as I say, is to be driven by these ideas about what motivates human behaviour, and they understand that as being economic rationality. And I think that is a major problem, because I don't think that we do live our lives to some extent with economic rationality. As secondary, I think first of all, people think what's the right thing to do, and the situations that they live in mean to say that in different contexts, different neighbourhoods, different regions, different countries and so on, that what is the right thing to do is going to be different in those different contexts.
Okay, so move along. Simon, do you want to come back on? Try and identify one thing.
Okay. I guess I should probably identify the one thing which is a direct question to me, which is, do I understand about autonomy in the family? If what you mean by that is that parents should be the primary educator and have choices around the way they educate their children, again, I go right back to what children would say, which is they want their parents to be the primary educator. When you talk to young people about values, culture and faith, one young woman in quite a big project I did around that said, I trust my family to talk to me about their values and their beliefs. What I want at school is to learn about what other people believe. So what I'm not suggesting is that professionals have the answer. What I'm saying is that parents are a primary educator and that professionals should work with other institutions to educate children. I absolutely agree with your son, and there's no way I would want my mother to go into the school either. But there are ways of doing this and doing it well. And I don't think, just to come back also on the point around, we must be getting it wrong if the project doesn't work. When I was saying that 50% of conceptions in under 18s end in abortion, what I wasn't saying is that abortion is wrong and it's not one of the solutions. What I was saying is that too many young people, for whatever reason, don't feel able to access contraceptive help and advice and support, and then to follow through on their intentions in relation to contraception. And I think that's a travesty, actually. We wouldn't want it for a 35-year-old. Why should we want it for a 14-year-old or a 17-year-old either?
Sure.
Well, I think on the third world point, I do think there is a connection between these debates, because not so much in the way you say it, although there is an expectation that initially in the New Labour project, an orientation on this issue was an idea that women in working class communities were still kind of oppressed in old ways, and that you needed a change in the culture in order to stop the normalisation of young childbearing, because that went with old-fashioned expectations of women. So I think then that, in that sense there was a connection there. But I think more now is the what Lesley talked about, the more eugenic concepts. And I've heard arguments about the problem with teenage pregnancy in the third world is the younger they start, the more babies they'll pop out. Which is all about the problems of more too many third worlders, and I think it's exactly parallel with the idea of an underclass over here, or dysfunctional base, whatever you want to call it. So in that sense, I think when we globalise these problems, we make them even more meaningless than they were to start with. I think on the question of professionalisation, one of the things I really cringe when I hear is this idea of parents lacking in the skills and confidence to talk to their children. And now there's a survey this week saying that teachers lack the skills and confidence to talk to their children, what we need is health professionals. And the thing I think about this is a generation of parents who are more sexually experienced than any other previous generation. We must have had more sex, surely. I've had a lot more sex than my parents, not necessarily, well, a little bit here. I think I'm more sexual than my mother was. But so I'm not so my parents, my children want to talk to me about it, fine if they don't want to, but I do think in terms of a variety of relationships conducted in the way in which we now conduct relationships, then our generation is peculiarly well equipped to talk to our children about it. I think it's bizarre to say that we lack the skills and confidence. We're told that we do, and I think that just undermines our skills and confidence even further. I think that I just wanted to quickly raise this point about economic rationality, because I think the whole point about teenagers is that they're presumed to be irrational or incapable of exercising reason. So, and in the sense that they have become emblematic of the kind of sexual subject or the kind of the person who, the new kind of parent, then I think that tells us a lot about our expectations of people's ability to exercise reason. So I don't think they're being held to something, to a kind of ideal of economic rationality that they can't live up to. And in some ways, I think the economic rationality is completely removed from the equation when it comes to teenage mothers in a really problematic way, and particularly when it comes to teenage fathers. The research, when I was talking to teenage mothers, I was really struck by the kind of absence of the fathers, except in an emotional and biological way. So the mothers brought them back in to have a relationship with the child that was nominal and was on the birth certificate and was about being nice and playing with the child. But actually, in terms of having a really adult relationship with that child, where you're fully taking responsibility for it, it was completely absent. And my fear is is that the more we offer this kind of very, very intrusive support to young mothers, we actually endanger their capacity to exercise autonomy as parents and adults in a way that the fathers are already excluded from that kind of equation. That we decenter those the parents left the mother even further.
Yes, I'll just pick up on a couple of points, and the first one is about the professionally driven policy. And I would agree with the point made that there really is a lack of consensus amongst professionals and practitioners. But they are driven by a policy, and they're not just driven by policy in terms of the policy that they have to work towards, but really concretely by particular targets. So, for example, I'm working at the moment in 2 South London boroughs where they've had a really good piece of research that was undertaken and finished about a year ago, which, for young people, which they said what they want is a good choice, they want to be able to choose which contraception fits their particular relationships, their particular life at any particular moment in time. And what the professionals have taken away from that is, yes, we have to work towards that, but also we have to tick these boxes. So we do have to get so many implants in per month, and that really does contradict what they're wanting to do in other respects. So there's a lack of consensus. There are also very difficult policy-driven targets that they're working within, and to a greater or lesser extent, people will subvert the policy framework, or they will do the best that they can within that particular framework. And I do think that these are very much often issue-driven. I just also wanted to comment a little bit about young people and parents and where do they learn about sexual relationships and contraception. I mean, I know a lot of us have said that these are complicated issues, and they are, and they're difficult for young people who are becoming sexually active. This is not an easy transition, and yet, what sometimes it's also simple. What young people need is to know that if they've got a problem, or if they want contraception, or if they're worried, for example, one of my daughter's friends had sex with her boyfriend for the first time, and she thought she'd got an STI. She didn't know where to go, so she asked my daughter, who asked me, to tell her where to go. Now that's just not acceptable. She wouldn't want to speak to her mum, and I can understand that. And I'm sure my daughter wouldn't want to talk to me, however liberal, or whatever I am. I'm the last person she would want to to tell that she thought she had an STI. What young people need is really, really obvious and clear places to go where they can get impartial, non-judgmental advice and contraceptive services. And it seems to me that's not really that difficult, and it's not too big a demand. And I can't believe that after all these years of a teenage pregnancy strategy that we still don't have that, and that somebody is talking to me at 6 o'clock in the evening about her friend who's worried about this.
Okay, apart from Brooke, obviously. Okay, so more questions? Or Eleni there, yeah?
Is it a question? It's about the nurse-family partnership, which Jan mentioned. Andrew Lansley announced yesterday that the pilots, which were going prior to the coalition, one of the first things the coalition is going to do as part of its public health strategy is to expand the nurse-family partnership. It's interesting that this has been warmly welcomed by people at the centre of the old teenage pregnancy strategy and seen as a very positive development. For me, it sums up everything terrible and negative that I perceive going on in the area of family policy and parenting in particular, essentially extending parent training back into pregnancy, directed to start with at teenagers, entirely based on the presumption that they're breeding too fast and their breeding is problematic, and that you need to send in nurses to retrain them in the right ways of breeding. And no doubt this will get expanded. I was just interested in what people thought about it and what people thought about the fact that this has been welcomed by the people who were at the centre of the old strategy.
Okay. There's a guy at the very back.
I had this comic experience with my daughter's school where there's a huge row about sex education for her class age about 8 and 9. And it was pointed that how it divided, because all the teachers and the middle class parents were emphatic, absolutely emphatic, that they must be educated in as much detail as possible straight away. Whereas most of the working class mothers were much more resistant and embarrassed and felt that they were losing control of something. I must admit, as I was looking at it, I couldn't see much harm in it, but I wondered what... I don't think any of the 8-year-olds involved came away with a great deal of understanding. They learned that their willies and fannies were actually called penises and vaginas, which just seemed to give them a great stock of insults to throw at each other in the playground. But it seemed to tell us a lot more about us, that for a lot of us it was absolutely the important thing. I don't think there's much danger that any of them at age 8 will be pregnant, but obviously there's always a statistical exception. But it seemed to me that it was saying a lot more about the way we were reacting to our children, who mostly were a little bit embarrassed about the whole thing.
Is there anyone over there? Yes, there's somebody here on this side.
I would just like to ask a panel to address a key issue that has been left out. Under current law in the UK, legally, anyone under 16 are bound to their parents' decision. For example, if my parents say I have to go... if my parents say I have to go to public school, then I have to by law. And then this issue brings up quite a few different variations within pregnancy about who should have power over a baby or not, whether it's the pregnant teenager or their parents in question. So my question is, of the two groups, which do you feel have seniority over the decision of abortions and whether the baby should be kept or not?
Very good question. And I'll take one other question from the middle there in the back. Yeah, guy with glasses.
Okay, thank you. Very much agree with what Ellie was saying earlier, and it ties in with what Joan was saying in her introduction about infantilising parents, because I think obviously the flip side to that is parental determinism, which people on the panel have already alluded to as well. So what I've kind of tended to notice, particularly over the last 10 years, is that the framework through which teenage motherhood was discussed has expanded elsewhere. So I've read articles warning the dangers of 24-year-old women of getting pregnant and having a baby. And the more extreme cases, I suppose, was the woman who was, 59, who got pregnant through reproductive technologies. Again, the mantra seems to be can't cope. Teenagers can't cope. 24-year-old mothers can't cope. A woman who decides to have a baby later on in life can't cope. And it seems to me that teenage pregnancy, teenage motherhood is a framework through which the professionalisation of motherhood has become justified, because it's not just teenagers now. As Ellie kind of rightly pointed out, it is expanding everywhere in terms of motherhood is now automatically associated with frail individuals who can't cope without a network of professional guidance.
Okay, I'm going to come back to the panel, but can you please just address one issue very briefly, because I want to take another round of questions before we can finally sum up. So, okay, Lesley, do you want to start this time?
I just wanted to very briefly respond on the issue of who should choose for somebody under 16-year-old who's pregnant. And I believe very strongly that it's the teenager who's pregnant who has that choice, and that is in fact how it is legally in this country, that they may be encouraged to talk to their parents, but they're not obliged to do so. And I think it would be very dangerous if that changed.
Jen, on the I never said notice how many partners
partnership, family nurse partnership, which way around it is over here, I always forget. I think the big interesting thing about this is the way in which health visitors are the ones that are tasked with bringing this forward. And this is, if they were called social workers, everybody would be up in arms because they don't like the idea of, or either they think social workers are incompetent or that they will interfere too much. But this scheme is totally legitimising basically their health visitors rather than social workers, and it's really interesting. It's very explicit in the policy previously, but that is a necessary step to legitimise this kind of intervention. Simon.
I just wanted to be very clear that it is the young person's choice as long as they're able to consent, and we need to be very clear about the legal framework in relation to that. I guess I'm quite interested in whether lots of our conversation here is a little bit before the election in terms of the targets, and we actually don't know what the future is going to look like. My understanding, Ellie, and I understand many of your concerns, but lots of people quite liked it when health visitors had a bit more time to spend and less of a caseload 20 or 30 years ago. And is it that actually when we come back right down to what's offered in terms of support and services, that people tend to like it? It's the way it's constructed through policy that we object to, and somehow we've got to find a way to bring those two things together. Otherwise, we're in danger of disappearing in a circle of discussion that won't actually help communities.
Well, I wanted to raise the issues of class and race. I want to raise the issue of class and race in regard to parenting, which is in terms of parenting being thought about as a set of skills rather than a relationship. And it's very easy for white middle class people to have the skills, and less easy for white working class and black working class people.
Very good points. Okay, I'm going to take a last round of questions, and then we'll get the panel to respond. So this young woman in front.
Just quite a brief question. Do you not think that social policy, well, it's really obsessed with young mums because media is obsessed with young mums, and I know quite a while back there were so many stories, and as sort of residual impact from that, it's just sort of been left there. Do you not think that at the moment it's just sort of a response to a moral panic, as you've just said, to what has been in the media, and that's probably why maybe the social policies are so confused, because it's just a sort of appeasement to young mums.
Okay. The guy just behind you with the...
Thanks. Isn't it just that we're policy obsessed on this because our rates are just much higher than places like the Netherlands? And isn't really the issue not talking about teenage pregnancy strategies? It's simply that in places like the Netherlands, it's unacceptable for people to come out of school with very poor levels of educational attainment. I just don't understand why we're not talking about the bigger picture here.
There's a woman here in front.
Well, I think talking about the bigger picture, if I understand Jan rightly, in some ways, Jan, you're saying that discussion about teenage pregnancy is actually a displacement activity for us talking about adult relationships, sexual values, and parenting values. You know, so it's much more easy to point the finger and look at the awfulness of teenage pregnancy than it is for us really to say what values do we believe about sexual relationships, how men and women should operate with each other, or men and men, or women and women, for example. Exactly, should there be judgments made around how people should parent? You know, not in the way that judgments are made towards teenage pregnancy, but just as societal values, are there any that we agree with or not? It does seem to be, what Jan is saying is that the teenage mother becomes a replacement for us as adults taking responsibility about having that sort of discussion. And I think then the way we respond to it is actually creating this very technical discussion. So, you know, you just think, how can you have parenting lessons in schools when then that actually makes parenting entirely technical, which it never can be. You know, apart from showing someone how to put on a nappy, you know, you might say there is a technical how to tie a nappy pin, but really, and actually to be fair, sexual education, I agree with Lesley. I mean, obviously at a certain point it is important that people know where to get good contraception, where to get good neutral advice. But the thing about continual lessons around that, again, creates a very technical, so part of it is technical, where do you go to find contraceptive information and how do you do whatever you do with contraception. But the notion of lessons is, does denigrate and take responsibility of us as adults, I think, in thinking about it.
Okay, was there a hand over there? Okay, that's the woman here then.
Hello, I'm visiting from Norway, so I'm not really familiar with this debate. And I just wanted to ask a really simple question. It seemed to me when you were all speaking that you kind of wanted to distance yourself from the stigma attached to this and the fact that people are discussing teenage pregnancies as a problem. My question is simply, is it a problem with teenage pregnancies? And if so, what is the problem with it?
We're ending where we started. Is it a problem? What kind of problem is it? Okay, we've got a little bit of time, so you've got a chance to give good, fulsome answers as your final remarks. And shall we start in the way we started with Simon?
Where to start and where to finish. I think, for me, you're absolutely right. It is part of a broader agenda, which is what do we hope for young people in this country. And all of us, I would guess, hope for them to have the best start in life. Where that then divulges is what the best start is. And for me, that's about having care, it's about having love, and it's about having the support that they like, that they want, that they need. I actually think one of the really interesting things around this whole conversation, you started talking about lessons. How do we have lessons? People always look to the Netherlands as an answer. If you go and look at their sex education, it is technical. It's very, very practical. But they also don't have a tabloid press. They also don't have lots of the hang-ups that we have about sex and about relationships. And I just take us, in the end, right back to the beginning. Now, children and young people still tell us that they arrive at early adulthood, often without the education and support that they need in order to be able to manage their sexual feelings, their sexual lives and their sexual choices. Now, whatever we do going forward, whether that's parents who have less or more sex than their children, whether that's schools and teachers who have a set sex and relationships education programme, whether it's health visitors that are called social workers or health visitors, the reality is that to continue to have young people who have sex that they don't know if they want, that they don't know if they've had, is not something that I think is acceptable in 2010 in this country. So for me the argument is much more about relationships, much more about sex, and much less about exactly what the policy framework is. And right now we will have a choice, which is, do we continue to argue for young people to get the sort of education support they need, however that is constructed, in order for them to be able to enjoy and take responsibility for their sex? Or do we actually say this is nothing to do with the state, let's let parents get on with it, let's let it come down to local choices and local decisions, and love them or hate targets. The reality is that they have done something to improve consistency of some provision. And my feeling is that unless we keep teenage pregnancy, teenage sex on top of the agenda with some framework around which people understand how to deliver, we'll go back to a postcode lottery where people may be contacting their friend's parent at 6 o'clock in the evening and they may well be saying, sorry, there isn't anywhere that you can get emergency contraception, an STI test or contraception for another 4, 5, 6 days. Because that's the reality of what's happening on the ground with sexual health services.
Yeah, I think I wanted to say, I don't think it's much... I think that we need to take the focus off the age issue, because I think what people are raising here are issues that apply no matter what people's age are. And I do think that the structural circumstances are important. As I said right at the beginning, that actually people need to have good quality education, access to good quality education and and employment and training and housing and so on. I don't think that teenage motherhood is a dreadful thing. I actually, because I was a teenage mother, I come from a long line of young mothers. And I think it's brilliant. You have your children young and then you can get on and do other things in your life. So I think there is you can make an argument for it. And I think that we need to take the foot off values and thinking that we don't know what we want as a society, and parents are sort of being infantilized or professionalized and so on. I think actually that it's really good to have a debate about these issues. I think that's important, that we shouldn't actually all agree what we want. I think that's really dangerous.
Thank you. Lesley?
Yes, is there a problem? I agree that I think we should take age out of the way that we formulate these issues. And I really do think that the problem is becoming pregnant when you don't want to be, and then possibly, in some cases, not being able to, or finding it difficult or troublesome to access abortion services easily and without any sort of stigmatisation at all. I mean, we know that a lot of research on abortion has shown that for many women, going to their GPs and requesting an abortion is the worst part of the whole process. However, having said that, I would agree to decouple age from this issue. I do think that for young people, all these things are much, much more difficult. So somebody who becomes pregnant when they don't want to be at the age of 35 or 45 is much better placed to deal with it than somebody who becomes pregnant when they don't want to be at the age of 14. So I'm in danger of saying yes but no but here, but I do think that it's not an easy picture. And in terms of the services that have been developed, I do agree that the services that have been developed since the teenage pregnancy strategy started have improved the possibility for all women, and particularly for young women, to control their fertility, to control their reproductive lives. And at the moment, in a situation of cuts, in a situation where probably, we don't know what's going to happen to the teenage pregnancy strategy. Maybe Simon does. I certainly don't know, and the people that I talk to don't know. We think that possibly there's going to be a renewed focus on young people as being particularly problematic in general, and so looking at a whole number of problems that young people have, and teenage pregnancy will possibly be a part of that package. But in terms of the services that young people can access and that all women and men can access, we definitely have to mount a rearguard action to defend those services.
Thank you. Jan?
To address this point about the media and moral panics, I don't think it was the media. The media interest comes after the policy ramps up the concern with it, and the media flip-flops in both directions. So I get calls from probably everybody else all the time from, hello, I'm Tristan, calling from Channel 4. I'm putting together a documentary because we think teenage mothers have been stigmatised, and we hear that you're trying to go in the other direction. And then every few weeks I get a call like that, and it's always Benjamin or Tristan or Damien from the BBC or something. And it's just the flip side of the kind of, the prurient TV docs that follow teenage mums screwing it up, basically. So, neither of them are very helpful, but I don't think they explain the policy preoccupation. On the new point about the Netherlands, well, I think the problem is when you try to do these international comparisons, that each country has got so many different components that are different that feed into teenage pregnancy rates that really it's very difficult to make a comparison. So the Netherlands has got very low divorce rates and still much higher commitment to religion. So how do you want to change Britain in that direction? Do we bring back in Catholicism, or what do we do? So I do think. Well, but the problem is that the reason why some girls get pregnant is not just because the schools have failed them. I mean, there is that there's obviously a very, very strong class component, and it is absolutely clear that that's the case, and it isn't something that happens to everybody, which is probably why working class parents are much more concerned about this and realise that they have very little control over it. And it's something that's a very big source of anxiety to them, rather than middle class parents who know it won't happen to them. And if it does, they can probably steer their daughter with a promise of their future towards an abortion. So I think the outcomes are completely different. There's a real cultural gulf between different experiences in this, I think. But I don't think just kind of offering up a model from another country really helps us particularly. I think to look at where things are going next, then I think that the thing I'm most concerned at is that I think we've come back round in some of the, if we try to look at where policy is going now with the coalition, to an absolute short-circuiting of young people's lives. So what I mean by that is in the document that was talked about a lot this morning, the Ian Duncan Smith, Graham Allen document, and Graham Allen is the guy on teenage pregnancy at the moment in policy terms. They're talking about the big concern is the years 0 to 3. The problem of 0 to 3 is that when it comes to teenage parenthood is that under 18-year-olds or under 19-year-olds are ill-equipped to fulfil all the criteria that's necessary to bring a child through 0 to 3 successfully. And so they talk about the 0 to 3 window and the 0 to 18 window. And so what they then advocate is parenting classes for the 0 to 18s in disadvantaged areas, so that when they inevitably become teenage parents, they will then be equipped to fulfil their obligations to the 0 to 3 in the 0 to 3 window. And that, to me, absolutely normalises teenage pregnancy in a really, really unhelpful way, completely lowers people's aspirations and the expectations of young people. Most of working class young people don't become parents as teenagers, and we need to remember that. And all that's on offer then is the kind of cauterisation of social disadvantage, or the effects of social disadvantage, and cauterising it for its impact on everybody else. There's no prospect of actually helping people try to come through adolescence into something with some promise at the other end of it, which is what middle class young people have been able to take for granted, which is why they don't tend to get pregnant.
Fantastic. Before I ask you to thank the speakers, I think they've been a brilliant panel. I know we've far from answered all the questions that have been raised, and that's the nature of these discussions, so feel free to continue discussing informally. If you're particularly interested in the discussion around early intervention, there's a discussion happening here in half an hour called Early Intervention, Saving Children from Their Future, and then that's going to be followed by another discussion of why policy is focusing on fathers, called Building Dads. The bookshop is open upstairs, Boys Bookshop, so please do visit it. And if you want to have a chat to the speakers, I'm sure they'll hang around for a little bit. But in the meantime, can we thank